Hi everybody, welcome to the Becky and Boca Show. Today I'm going to show you a non-surgical hand vein removal procedure performed by Dr. Christopher Pittman of Vein 911. This is a cosmetic procedure for those of us who are unhappy with our prominent hand veins. Dr. Pittman has several offices throughout the Tampa Bay area and will soon be opening in Boca Raton. So let's see how this procedure is done. Okay, I'm here with Lisa. We're waiting for Dr. Pittman to come in. He is going to take care of her hand veins. Lisa, you want to show those veins?
Yes, I have very large, green, unattractive hand veins. So I'm very excited about doing something about them.
Mine were way worse than yours, and I had them done by Dr. Pittman 7 years ago, and not a single vein ever came back.
As you get older, you can fix your face, you can do good health care,
Yes.
You can work out, you can eat healthy, but your veins are your veins.
That's exactly the problem I had. And I'm always holding a microphone. We can do the Botox to our face, we can do the filler, all that. Some doctors do fillers on hands, but it's not as effective.
Right.
So I was always looking for something to do with my hand. I was putting makeup on.
Right. Makeup, tons of lotion. It just really doesn't
Doesn't
do
help.
And the veins, when they're green, you know, when they're dark, and it's just unattractive. But I just thought it was something you live with.
Yeah.
You look at the difference. Like,
Oh, I could show you my befores. I had serious veins. Purple, some of them were almost black. They were all bulging.
Yeah.
So it's a simple procedure, painless. You won't
It's
feel
incredible.
a thing. You're going to like this.
I'm excited. I'm excited. And I know he's renowned. And
Yes, he is.
so we're in good hands.
Okay.
No pun intended.
You are Van. You are.
I'm a medical assistant here at Vein 911, and I'm going to have you sign consent and then take some hand photos.
Okay.
Okay.
Yeah. I'm going to put this right here.
Thank you.
And then if you can have both of your legs flat down for me, and then
Okay.
put both your hands right that on your lap.
I imagine we have to get her to take off that
Take off
beautiful
my
jewelry, huh?
jewelry.
Are you able to?
Mhm. Today I can. You never
Yes.
know. That's how much. Oh my gosh.
Yeah. All right. So this is the before.
Oh my goodness.
Yeah.
Hello, hello.
Hello, Dr. Pittman.
Miss Amick, nice to
Hello.
meet you.
Nice to meet you as well.
And so,
Excited.
where are you from originally?
Indianapolis, Carmel, Indiana.
Indianapolis. So, what do you do?
Well, I'm retired.
What did you used to do?
Now, I used to be in sales and marketing management with Johnson & Johnson.
And what do you do for fun now?
Oh gosh.
Besides hang out with
Anything I
Becky.
want.
She was hanging out with me, and I
Yeah,
showed her my
yeah.
hand veins that you did. I think it was 7 years ago, Dr. Pittman.
Oh my gosh.
He only had to do my hands once.
She is
Now,
like
some people
an
you have to
outlier.
do more than.
The average person is going to need 2, maybe 3.
Okay.
Do you have any questions about this? I mean,
No,
concerns,
I
comments,
don't. I'm
criticisms?
just very excited. I just
Awesome.
think that I know your reputation.
Awesome.
I know that you're really skilled at what you do, and I've seen this, so I'm very, very excited.
So why don't we have you do that, just in
Okay.
case you get nervous or something. Your veins actually have a lot of little muscles in them.
Okay.
So what we get asked a lot is, do I need these veins? Okay, and basically
Yes.
we don't. If you have a vein access issue in a hospital, they're going to call an interventional radiologist like myself, or like cardiologists outside the heart, but we're really image-guided surgeons, because I don't want to give short shrift to my specialty. But the last place we're going to put an emergency vein is on the back of a hand. We're not going to do that.
People worry that you need the hand veins
yeah.
in case you need an IV. I remember people, when I
I'm
was
gonna
getting this
roll it.
done.
All out for you.
Yeah.
So 20% of people don't even have a hand vein.
Okay.
And they're not suffering and they're not dying. So when they go to the hospital, there's just no vein there. So they're fine. We use ultrasound to find veins. So veins can hide, but they can't run from the ultrasound machine. Generally, you're going to put catheters in jugular veins or femoral veins, and look, you don't need these darn things. Well, what if I'm in a car wreck and I'm ejected and I'm at roadside and they need to get IV access and they can't get it? Well, like
There's
I
no
told
other
you,
place in your body.
this is the wrong place to go. Okay, and I won't get into all the super details. This is not where you're going to go. In general, we don't do things in medicine in the expectation of something. You know, if something's bothering somebody or it's bothering their lifestyle or whatever, we do it. What a lot of folks are doing is putting filler in the back of the hand. Frankly, they charge about what I charge, and they get the opportunity to do it again in a couple of years. It really doesn't work well. Some will do fat transfers and all of these other things. So in any case, any other questions you got about this?
No.
Then I'll roll this out. It's not going to hurt. We're going to use the magic foam. Foam is a future of vein care available today. Anything we do in cosmetic medicine, we don't want to overdo it, right? We're creating a masterpiece. We want to do several coats of paint. So it's not realistic to think this is all going to get done in one. You might get a little swelling in the back of the hand, rarely the fingers. That's why we have people take their rings off. We're going to treat you from about your knuckles to here, and inevitably some of that foam is going to come up here. So we're not going to leave you with no veins here and some bulgers here. It's going to be very, it's going to be very cosmetic. Over the next few months, you know, we'll negotiate and say, I don't like that, we'll get rid of that. But I've never had anybody unhappy doing this. Not a lot of people do it. Frankly, I wouldn't go to anybody that doesn't have a lot of experience doing this. And I have cleaned up some messes from around the U.S. You know, there's some doctors who very thoughtful about what they do, and others that says, hey, let's give this a whirl and see how.
Let's try it.
Let's practice medicine. You know, there's a whole gradation on all of that. So anyway, any other questions, comments, criticisms?
When do I see the results?
Great. I should have said that. You are going to look 70 to 90% better overnight.
Oh, wow.
70 to 90% better overnight.
I remember that.
Okay?
Yeah.
We're going to put something called Coban around your hands and wrist, and you're going to look like a prize fighter. You're going to want to keep that on overnight. There's no restrictions, okay? You can do whatever you want. Go to a hockey game, maybe even put on boxing gloves. But you'll be wrapped in this flesh-colored stuff that you're going to see here in a moment. And the reason is we want to flatten the vein.
Okay.
So yeah, let's cover a few more things here. So this works 100% of the time. It's not a question of whether it's going to work or not. It's really a question of how many sessions are we going to need, and then navigating blood coagulum that's going to get caught in these veins. What I mean by that is inevitably some blood, no matter what we do, is going to get trapped in these veins. That's the same in the leg veins. That's why we torture people with compression hose after spider veins, is to limit the amount of blood that collects in the dead vein, because it looks crappy for a long time. And we have a drive-through mentality, right? We want to look schoolgirl legs tomorrow and schoolgirl hands tomorrow. In any case, some blood is going to collect in here, but the vein will be dead, and we'll touch it like this and we can tell that it's dead. So we'll want to see you back anywhere from a few days to a few weeks. We'll take a little needle, bump, 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 push the blood out, and you're going to look better quicker. Now, we don't need to do that. Ultimately, your body would absorb it, but it has to do it one white blood cell at a time. If people are from out of town, they might fly back. They don't have to come back in weeks. You know, we can work around that. So I think that's about it.
Okay.
And so
you
ready to rock and roll?
Yeah, I'm excited.
Okay.
All right. So now what we're going to do, I want you to just keep your elbow like that. And just like that. Perfect. And then Van's going to put little alcohol squares there. Again, this instrument, it's not a needle. We only use instruments here. It's the size of a hair shaft, okay? Most doctors have not seen a 32 gauge needle. It is quite tiny. So we're making the magic foam. Little pinch, pinch, pinch here. Doing all right? Is it hurting? Is it burning? Anyway, you are an excellent candidate for this, and you are just gonna look great. Foam is like cappuccino cream or shaving cream. It's not foam insulation. We're not leaving foam in anybody. This stuff destroys the lining of the vein on contact, and it's gone in about 8 seconds. So it's just amazing stuff. It's been around a really long time, but it is little utilized in this country for medical or cosmetic vein care, which is too bad. Some people try to pluck these out surgically. They'll put little lasers in them. I wouldn't sign up for any of that.
How long have you done this?
We were talking about that. I'll take another cotton there. Yesterday, that's a loaded question. How long have I been doing interventional radiology? I am a lot older than I look. It is the red hair. I have been board certified in radiology for 30 years. So I've really been doing minimally invasive stuff that long. And then I've been doing what we call superficial vein stuff for 17 years. So I think actually I'm going to leave it where it is right now, and what I'm going to do is have you, this is just awesome. So we're going to do this, and we're going to have you just hold your hand like that, okay? We're going to come around the other side here. So we're going to do the same thing here. So these veins are a bit bigger.
So you're making the foam now?
I'm making the foam.
Okay.
And to those casual observers, it's like, it's nothing. There's a lot. We're compressing, we're doing a lot of different stuff. Foam is like a symphony orchestra, and other vein treatments I describe as a kazoo. But in any case, there's a lot of nuances to it. So yeah, she'll look 70 to 90% better overnight, and I sure hope Becky and Boca gets a follow-up in the morning.
Right.
One other factoid that I think's fun, and I'd like to share it, is the people who drive the furthest to see us look the best, the quickest, because
their hands are up.
Correct.
Yeah, that was true for me because I had 4 hours at 10 and 2.
It's just so I tell people, if you want to drive to Miami today,
back to South
Florida. Yeah, you can obviously see the foam occupying the space of the vein, and it gets subtly not green anymore. And I'm going to need another cotton, please. And good chunk of tape there. I think what we're going to do is have you do this, and just you want to keep it right up like that. And we're going to look back over here and see if we don't need a little touch up or something. I think we'll do a little bit more here. I'm just reinforcing this vein because it was the biggest one. And again, this is just nuance, but trying to prevent, trying to get as much done now. Reinforcement there, because neither of us are going to want to see that wrist vein there. We will not be happy. So we're going to get that now. So come back and do the same thing over there.
You're going to be amazed tomorrow. It'll be like, how is this possible?
I just can't believe how painless this is.
We're going to have the Academy Award-winning reveal tomorrow.
That angle.
Pinch, pinch. Okay, one more cotton, please, and that's it for the torture.
It's not torture at all.
You don't know the things we go through, Chris.
Yeah.
This is nothing.
It's all relative.
I know. I was packing the
I gave
cannon.
you a list of the things I've
Tape.
done in the interest of looking better.
Look,
Oh God. Go look at all my old
the
videos.
ladies are so much tougher than the guys.
I know.
Way tougher, without any doubt. So I'm going to start fairly down the forearm here because we had some bulgy veins there. We got some foam in it, so I want them to be compressed. So I'm going to put this on fairly tight, and it's very easy to adjust. You feel numb, tingly, hurt, or you just don't like it, okay? You're not going to sacrifice anything. Do not let yourself be uncomfortable is what I'm saying. And think, I'm going to go through this no matter what because it's going to look crappy if I don't. No.
Right.
No. It sticks to itself, but not you. So it's real easy to adjust. So what you guys doing after this, anything fun?
Lisa's going out dancing.
You should. well,
You can wear
Becky knows what to wear with this.
I'll be drinking wine.
I wore one of those, you know those pullovers that have the little thumb holes, thumb hooks?
I brought one because I saw that.
Yeah, you can totally get away with that.
All right.
Yeah.
All right. So, how you feeling?
Great.
What a country. So,
Yes.
that's it.
Okay, so Lisa, you're all done. You did great.
It was amazing.
No big deal, right?
No big deal. But it's going to be a big deal.
Yeah, it will be a big deal. Okay,
It was.
Dr. Pittman, you did a great job. I enjoyed watching this again. I remember when I had it done, and
It's fun.
yeah.
It's fun. If it's bothering the ladies, get rid of it. A lot of folks don't realize they can have this done, which is,
Yeah.
they all wonder, and then they get wrong answers from people who don't do this. So anyway, you should keep this on overnight. You can take it off in the morning, but if you keep it on till about noon, I prefer that.
Okay.
Remember, you can loosen that up any time you want, and you should if your fingers go numb, tingly, or anything like that. Typically, people do fly in and fly out. I would see you, late morning. But I don't think we need to do that because you're in town. So I would wait probably 2 to 3 weeks for the dust to settle. If you got any problems, you can call me, which you're not going to, but you're welcome to. What I mean, you're not going to have any problems. What we're going to do next time we see you is we're probably going to take out some of the little trapped blood and probably inject a little more just to fine-tune everything.
Okay.
And you may take a second session or even a third session. And so we charge one price to do this. We don't do a la carte stuff until we're both happy over a 6-month period of time.
So there's no charge for follow-ups, is what you're saying?
No, I just one charge.
Okay.
Tune-ups are really rare. Once they're gone, they're gone. And that's it. But sometimes, a little one over time. But it's pretty uncommon, probably less than 5%. But anyway, we're probably going to need to do a little more. It should be 70-90% better, but there's going to be a vein that's like
a dark vein.
Yeah, still there.
Right.
Yeah.
But it's dead. And within 4 months, everything will kind of settle out. And I mean, 6 months is just kind of what we pick. And then if you want something done after that, we boutique charge you, but that's very rare.
How far in advance do I need to make an appointment?
You're gonna make an appointment right now.
Okay.
That's what we're gonna do.
Okay.
No leaving here without an appointment.
Perfect.
So, questions, comments, criticisms?
I am shocked at how simple it felt, and also what the results are going to be. So incredible. So
awesome. All right.
Thank
Great
you
to
so
see
much.
you.
This was
So
amazing.
long.
How are you?
Okay, wait, come over here. I want to see these hands. Oh my gosh.
Is this incredible?
Oh my gosh.
Can you believe that?
I can see they're
There's a little
swollen.
swelling.
Just yesterday, she had all
yesterday.
these big bulging veins.
huge.
So not to say anything bad
Yes,
about you.
no, absolutely. I totally did not recognize my own hand.
And when, like you said, it's going to get better and better
Right.
over time. Even now, what a difference from yesterday.
Oh, 100%.
But remember what Dr. Pittman said. These veins are dead now.
Right.
They might get a little darker, but eventually they're going to dissolve and go away. He compared it to roadkill, remember?
Yeah, that's
He
right.
said it just takes a
It's
while.
just incredible. I mean, I just can't believe it. I really can't. So
you're
I love
happy?
it. Oh my gosh, are you kidding me? I'm thrilled.
And I
really.
was telling you that, I did it several years ago, so sometimes I forget how
Yeah.
bad my hands were. But I do know that I'm always got a microphone in my hand,
Yeah.
and I used to not
I
be
know.
able to do this because it was so
Yeah.
horrible.
I'm driving and I'm like, those are not my hands.
You didn't know this procedure even existed.
No, I didn't.
Most people don't.
I didn't.
I was a little apprehensive at first years ago to do it, but his wife had done it. She looked great, so I went ahead and did it.
Anyone that has veins, there's no way I would not do this if
Yeah.
if I saw this.
Not everybody
And-
has the kind of veins that we did, but
Right.
mine were worse than yours.
Yeah,
And
not much.
we're looking at our
Yeah,
hands
I
all day
know.
long, and we
Yeah.
just feel
You know, who
Yes.
is that?
It's crazy. It's crazy. It really is. It's just crazy. So I'm thrilled. I'm just thrilled. Thank you so much. And thanks, Dr. Pimmett.
Yeah, thank you, Dr. Pimmett, for both of us.
Right. We're so excited. Thank you very much.
Okay, it was great.
I love it. Thank you.
Okay, everybody, thanks for joining me in this episode of the Becky and Boca Show as we came to Vein 911 to see Dr. Christopher Pittman perform his amazing hand vein removal procedure. And you got to watch for him down in South Florida because he is expanding. Right, Dr. Pittman?
We're coming to Boca Raton.
All right.
It's been too long.
That's right.
Time to go down there.
Boca's a great
We're
place.
going.
You're going to like it. All right. Bye, everybody.
Like, those are not my hands. Those are not my hands.
And they're going to get better and better.
Oh, they are.